I live with two words, if only.
My name is Lieutenant Colonel Stephen Coffey.
My name is Kimberly Roger.
My name is Jeanette Averett.
My name is Sarah Keel.
My name is Desiree Collins Bradley.
I'm Susie Becken.
I experienced a diagnostic error.
My son, Stephen Coffey II, experienced a diagnostic error.
I experienced a diagnostic error.
My son, Chad, experienced a diagnostic error.
My 11-year-old daughter, Deance, who is medically complex, experienced a diagnosis error.
I experienced a delay in diagnosis of a serious, life-threatening sepsis caused by a routine laparoscopic hysterectomy.
His metabolic condition, galactosemia, was not fully explained to us as parents or among the military staff at the hospital.
I was told I needed to scale down my stress, so my doctor set me up with clinical massages, anger management, and even a nutritionist.
The appropriate workup for my anemia was not recommended.
When I saw the surgeon with symptoms of infection, it was not investigated and missed.
Deance went almost over a year being misdiagnosed.
And 1 week later, he had a liver transplant. What if the doctors who had told me on the phone my son had galactosemia clearly articulated the severity of his condition?
Nevertheless, I suffered a stroke a few months later at the age of 42. What if my doctor had prescribed a carotid artery examination and a full physical?
This resulted in the delay in my diagnosis of stage 2 colorectal cancer. What if appropriate diagnostic tests had been recommended and performed in a timely manner?
This delayed finding and treating an internal abscess, which in turn resulted in a massive hemorrhage and led to 2 emergency surgeries and septic shock. The impact to my family is immeasurable. What if my surgeon had done blood work or investigated my symptoms when I saw him in the office 3 weeks after my hysterectomy?
She actually had an antibiotic-resistant infection called serratia. She has permanent lung damage. My what if is, what if her primary care physician had not been in her tunnel vision of this is just a routine infection that Deance always gets and had consulted her other specialists, and B, had ordered further testing a whole lot sooner.
Chad was misdiagnosed 3 times in 1 year. He was ultimately diagnosed with stage 4 colorectal cancer. At the age of 37, Chad died after 16 months of treatment and painful side effects. What if the proper tests were done initially for an accurate diagnosis and treatment initiated earlier? Then maybe he would have survived.